Yeah. When we talk, most of the time people say that we are harsh, that our language is too harsh. But if you do the kind of job I do, and you see people in distress and dying helplessly, and you would have the kind of attitude and the action that I have. Over the years, I have seen a lot of people passing through a lot when it has to do with. Now, especially when we talk about cancer, we keep crying that there's a lot of conspiracy that has to do with most of these treatments, because the number one factor, the number one this thing for the practitioners is the financial return. So anything that is going to stand between them and their financial gain, they work contrary to it. Are you getting me? Professor Di Bella was a retired oncologist in Italy. He shouted, if an oncologist will tell you that, why should people keep dying after the gargantuan garrulous propensity that back up the cancer treatment? People spend their money, so people will sell their houses, and nothing come out of it at the end of the day. Now the truth is coming out. It keep on coming out. Listen to what this man says. Nobody with cancer has ever died of cancer when they take chemo. They died of other related issue, which are the causative effects of the radiation that they have taken. Now listen to this.
Everything I've seen in all the autopsies I've done of cancer patients, not one of them died of cancer. They died of liver failure, they died of cardiac failure, renal failure, all due to chemotherapy. We got a patient that had been...
Can you hear that? Can you hear that? Now look at the case of this particular woman she talked about. After the radiation, after chemotherapy, the woman was given 3 weeks to live, but she said we help her to live for 6 months so that she can say bye to her relations. What kind of saying goodbye is that? There is nothing good in that bye. It's a goodbye full of heart of sorrow, heart full of anxiety, heart full of the word unknown. You regret everything you have gone through in life. May we not be sick. Even when you see when doctors are sick with terminal disease, they become like jelly. But everybody talk with confidence when they are not the one that is having challenge. Now listen to this again.
Everything I've seen due to chemotherapy. We got a patient that had been through chemo and radiation, and they had cooked her liver and cooked her kidneys. We looked at the blood work and realized she had no organ function to speak of left. And I said, we can make her more comfortable, but the radiation treatment that they used on her has actually destroyed her organs. So we did what we could. She'd been given 3 weeks, we gave her 6 months, and she got time to say goodbye to her family. But I remember...
Can you hear that? The radiation they use on her has destroyed her organs. Destroy. When you see people who have passed through chemo, the cell in their body is dead. So ability for the body to bring up another fresh blood is no longer there. And that is why you see them. I had a patient who was taking 4 pints of blood every 2 weeks. She took 4 pints of blood. By the time they still brought her to the clinic, PCV was 6%. Can you imagine? Effects of radiation, effect of chemotherapy. And when this thing occur, at the end of the day, the person will pass on. But look at it. The one that is more painful is the conspiracy that goes with the outcome. When people died, where in this part of the world, people don't bother to do autopsy on all the rest of that. But this is a pathologist that has been doing autopsy for all the cancer patients in his country. Now, look at what he has to say when the results of that woman came out. Now, listen to him.
Everything I've seen in all the family, but I remember walking into the office the morning after she passed, and this internist was sitting on the waiting room couch, and I said, "What's the problem?" And she looked at me and she said, "I'm doing the death certificate, and I don't know what to write for cause of death." I said, "You might try writing the truth for a change." And she said, you know how much trouble I can get in by doing that? I said, if you're going to study with me, you're going to write the truth. And she wrote radiation poisoning, cause of death. She's the only doctor I've ever seen do that. She actually had the courage.
If you want to work with me, you have to write the truth. Those who say that make that kind of a statement, they are far between in medicine. They are very, very far between. Now listen. Somebody came out, he said he did a research and discovered that fruits can actually neutralize the effect of diabetics in the blood immediately. They asked him never to experiment it. That if you experimented it, the license will be withdrawn. So what is your interest? You are protecting, and the guy came and said there are only 3 companies that make insulin in the world. If that thing is known, there will not be market for insulin again. Can you imagine? For some people to keep on making money, this is the money I've been making for ages, from generation to generation, at the expense of human life. So if anybody wants to say anything contrary now, they will not allow it. The guy went ahead and demonstrated it under camera. The whole world see. And when I was watching it, I just laughed. It's the same fruit we use to neutralize diabetes in the blood at Dr.Sayemi clinic. After all, I have brought the testimony of a retired matron in a government hospital. Before that doesn't have again. By this year, she's 85. I met her when she was 80. Till now, nothing again. That's the power in what? In natural medicine. Now, I've come with another thing for you. You know, just when we talk about cancer and cancer treatment, what we use here is what we call a tetralogy. That means we attack the cancer from different angles in order for the patient to come. Cancer is not malaria. It's not typhoid. Are you getting me? It's not something that you can just say, oh, this is a walkover. No. But with meticulous pursuit of the treatment, we can get results. Prophet Bella got results. Even with cancer of the blood, he got results. So we have been getting results here too, to the glory of God. And that is why I'm introducing something else to you now. I'm introducing something else. And that is hydrogen water. What does it do for you? For example, those of you who have taken chemo, those of you who have, and your cells has been destroyed, a lot of toxins, and your body, this is what you need. I have detox I give to people before, but by the time you add this one to it, and what is it? Just water. You just drink the water, and just drink 1.5 liters per day for 2 weeks. Even by the time you drink for 3 days, for 1 week, you see your energy being coming back. It's automatic. So it's ideal for cancer patient and every other person that is going through other chronic and terminal disease. If you are having a high blood pressure, they have loaded your system with all manner of medication that you take on daily basis, you need this. If you have diabetes, you have been loaded with a lot of this thing that you have been taking on daily basis, you need this. All this one, you sit down and you feel tired, fatigue, then you need this hydrogen water. It is specially formulated. It's a powerful antioxidant. It boosts your immune system. It makes it to come alive and revitalize you. It neutralizes and reduces issue of aging. It makes your brain to come alive. It didn't allow blood to clot in your brain. When blood clots in your brain, you suffer stroke. And depends on the degree, you can suffer CVA, cerebral vascular accident. And that is where you see people losing their voice. They could not talk. Some people, the brain can rewind. They will see their children. They will not be able to recognize them. I've treated a patient like that before in the past. So, this water is all in all. It's all in all. If you are a stroke patient, whatever it is, you need it. Now, because of the costs of the equipment, I go out of my way, because what I'm after is the life of my patient. And we now have the water bottled. You can come in to the clinic either at Ikeja, either at Abule Ijoko, Sango in Ogun State, or either at Ibadan in our clinic, you can get the water there. They pack them 12 in a pack, and you can get the one you want, and you can begin to use it. And come back and give me the testimony thereafter. I don't want you to die. I want you to live, and live you must. Everybody has the right to live because God created us in His own image, and He doesn't want us to live in sorrow. We are bringing it to Abuja, we are bringing it to Port Harcourt, and we're coming to Enugu to cover the east. If you are in those places, you can begin to shout me. We will tell you how you get it. There's a day we are bringing it to Abuja. There's a day it's going to be, but you have to make a booking so that when it comes, you just pick your pack. We are coming for those who can make their booking. But if you are in Lagos State, you just come to Ikeja to pick it. We also have a spot at Ajadea where you can also pick. By the time you check on my number on the screen, you send me WhatsApp message, then I'll be able to give you the lowdown information. This is another life-saving equipment, life-saving adventure that we are going into in Dr. Sayemi Clinic. My name has not changed. Hear me, the son of Olushola, aka Dr. Sayemi. Thank you, and God bless.